need to do or would have areas of expertise or skills developed. And so I would try to connect them on those issues. And then I began to realize that they were helping each other quite a lot, and that actually reflected the help I'd gotten along the way as a fellow and as a junior faculty member. And so we tried various methods of trying to make it easier for people to interact and make it easier for people to work together. I think the current format, which is a combination of individual meetings with group meetings, was suggested by Januz Yazdani, and reflects what Ed Yellen has done with his group. And so where we are now is we have very fun, very interesting meetings where the group gets together and we go over whatever it is the mentee of the month selects. Usually we have two mentees, and they decide what it is that they want to do. So it's a mentees meeting, and the mentees plural with an apostrophe after it because it belongs to them. And they get to pick what will help them. And sometimes it's paper, sometimes it's a grant they're working on, sometimes it's a project that they're just getting started. Today it was going over a surprisingly negative reaction from the IRB and trying to figure out how was it that perhaps they had misunderstood what we were trying to do, and how could we explain the methods better and make it clear that we weren't putting anyone at risk and that the question was interesting and the study was achievable. So we end up trying to use a mix of venues to ensure that people get to work together and share skills and experiences, but also that they get some one-on-one time with their primary mentor so that they can talk career plans and things that are specific to their individual situation.
Do you feel this is unique to IHPS, or is this something that's different from other institutions?
Well, I think what's a little bit better at IHPS, I mean, so everybody tries to bring their mentees along. Everybody tries to develop the best possible scientists that they can. What I think we do particularly well at IHPS is see the individual and realize that each person has a set of goals that in any research unit they vary, but in a place like IHPS they vary more than most units because we've got everything from literally clinicians. Among clinicians, we have everything literally from anesthesia to urology, but then we have a whole bunch of people who aren't even clinicians and are different kinds of scientists and trying to pursue sociology or anthropology, etc. I work more with the clinician group, but I also work with social scientists, and making sure that you have a plan that fits the different career paths that each of those people might want to walk requires an extra level of openness to their interests and an extra level of planning for what it is that they're going to need. And I think that's pretty unusual. And then again, because we have that breadth of people and of interests, we can then connect those dots. So I said I work mainly with clinicians, but almost every one of my clinicians has a social scientist that they then are connected to, who helps them learn qualitative techniques or think about, there may be an economist helping them think about how to assess cost and utilization patterns. So the thing that I think is special to IHPS is that we really do have all those disciplines and we really do bring them all together.
Is that we were done? I think we've
Hold
got
on.
some good material.
Hold on, let's see what... Hey, is Brenda here?
Yeah, there's something for you.
Okay, ask Mitzi to go in.
I did already.
Okay, and I'll be right there.
Okay, and Kazi can do 2:30.
Okay, tell them that go ahead and start, and I'll be right there.
Okay.
You know what? No, never mind. I'll do it there. I'll come in a sec. Okay. What else do you want to ask? You want other universities?
Other universities.
Okay.
Let's get that quote.
Okay.
Talking about how the collaboration with other universities.
Just turn it on. I'll do it.
Okay. And go ahead.
Oh yeah, our collaborations are worldwide. So with the mentees meeting in my group, We usually have people, literally the easternmost point is National Taiwan University and the westernmost point is Hawaii. So if you start in Taiwan, you wrap all the way around the world to Hawaii. The frequent visitors include, we have a close colleague at Vanderbilt and we have colleagues at Stanford. Those people sometimes even come in person, the Stanford folks. But we have phone-in with people all around the world if they've been here before and they're continuing. A lot of times, so for instance, my colleague Raymond Kuo at the National Taiwan University came here to learn about our public reporting and the risk adjustment approaches that we do to measuring quality of care and how we correct for differences in patient populations. And he's carried that back to Taiwan, but he actually had a lot of statistical skills already before he arrived here, and he then is giving some of that back to other people in the mentee group. He's helping them figure out their problems when they run into tough statistical problems. So we trained him, and now he's training us, and that's really fun. And for us it's fun. Poor Raymond usually is getting up at 1 o'clock in the morning or 3 o'clock in the morning because of the time zone, and his wife is very tolerant, and we appreciate that very much. Thank you. But yeah, we're involved with folks all around the globe.
I like that.
Anything else in there?
Let's see, we got, how are the mentees selected? Is that, is it an informal process?
Yeah, and I don't really select, they select themselves.
Okay.
That might be worth seeing. What's the other question?
Do mentees receive help from
other mentors? Yeah, we already covered that.
Okay.
Right, with the economists and then Raymond.
Sure.
Okay. So let's
One
just do the
last
mentees
list.
selected.
Okay. Go ahead.
The mentees really select themselves, actually. So what happens, UCSF is such a great place. There's so many smart people just bursting with ideas. And so they will come and find people at IHPS or hear us giving talks and come up to us. And they'll say, well, my background has been over here. I heard what you're doing. I'm really interested. I wonder if I can apply this in your field or something like that. Or maybe your technique can help me in my field. And either way, it's okay with us. We're here. We're a resource for the university and beyond, but especially for the university. And so we really have people from a very large number of departments compared to most organized research units at this university or any other. We have a very broad representation of departments. And that's because UCSF has smart people who recognize the impact of health policy all across its campus. And so they're coming to us and trying to figure out how they can address health policy in meaningful ways. We have to learn about their context to be able to help them, but usually we have methods and data sets and experience that can help them grow themselves or build their own career in their area. And then hopefully they're a national and international leader in their context.